Hello students, today we'll start with a new topic that is a pre-anesthetic and general anesthetics. So first of all, the layout of the slides. In this slides, in this video, we will discuss about pre-anesthetics. What are the pre-anesthetic medications? What are the stages and depth of the anesthesia? And a general anesthetic introduction and the stages of general anesthetics. So, start with the pre-anesthetic medication. First of all, what is a pre-anesthetic? It is given prior to the anesthesia so that the patient can be calm and relieve the pain, and it protect against the undesirable effects of the subsequently administered anesthetics or the surgical procedures, and it facilitate the smooth induction of anesthesia, also lowered the required dose of anesthetics. So what are the pre-anesthetic medications? Like benzodiazepines, we give a benzodiazepine, midazolam or diazepam, or any anxiolytics or an amnesia. We can give barbiturates. Example is phenobarbital for sedation, diphenhydramine for the prevention of allergic reactions. We can give antihistamines. Next, we can give H2 receptor blockers like famotidine, ranitidine to reduce the gastric acid. For the pre-underlying conditions, we give a pre-anesthetic medication before the surgery so that the patient will be ready for the surgery and for the anesthesia. We can give antiemetics like ondansetron. It will prevent the aspiration of the stomach content and post-surgical vomiting. Examples are acetaminophen, celecoxib, or opioids. These are for analgesia. Some anticholinergic drugs like glycopyrrolate or scopolamine. It is given for amnesia. It reduces the bronchial and salivary secretions, or irritant inhale anesthetic cause excessive salivation and secretion, so they are given anticholinergics. It also reduces any tendency to bronchospasm and prevent the bradycardia and hypotension. So manipulation of visceral organs stimulates the vagus leading to the bradycardia. Concomitant use of other drugs are the patients may take medication for underlying diseases or abuse the drugs that alter the response to anesthetics. Example like alcoholics have elevated levels of liver enzymes that metabolizes the anesthetics, and drug abusers may be tolerant to opioids. This is the stages and the depth of the anesthesia. The general anesthesia has three stages. First is induction of the anesthesia, maintenance of the anesthesia, and the recovery from the anesthesia. First of all, we will give the pre-anesthetic medications, and induced by IV thiopental or suitable alternative. We use a muscle relaxants for an injury, and use usually a mixture of N2O and halogenated hydrocarbons, and maintain and monitor the patients. After that, withdraw the drugs and the patient will be recovered. Secondly, the second part is the general anesthetics. After giving the pre-anesthesia, we give the general anesthetics, and already we have seen what is anesthetics. It is to produce the calmness of the patients to can so that they can suffer from the pain. They will not suffer from the pain. So the general anesthetics are the drugs which produce a controlled reversible depression of the functional activities of the central nervous system, producing the loss of sensation and consciousness. General anesthesia is a reversible state of CNS depression, causing a loss of response and perception of the stimuli. For the patient undergoing the surgical or medical procedures, anesthesia provides five important benefits. First is the sedation and reduce the anxiety, lack of awarenesses and amnesia, skeletal muscle relaxations, suppression of undesirable reflexes, and analgesia. Because no single agent provides all desirable properties, both rapidly and safely, several categories of drugs are combined, like IV and inhaled anesthesia and pre anesthesia medicines to produce optimal anesthesia known as a balanced anesthesia. That's all for